activities that have been going on in different regions, because they were the one, ACMG got the grant to be the National Coordinating Center for all these 7 regional collaboratives. So basically, and I know I've worked with Megan, he has done an amazing job, and I've admired how gracefully she's pulled all of us together to facilitate our connections with each other and to promote HRSA's efforts. Welcome. Please join me in welcoming Megan.
Do you just want me to click through? Sorry, it's going to go fast. That was near the end of the presentation. Thank you so much to Dr. Singh and SERN for the invitation to speak today and for your wonderful words. Dr. Singh, it's always great to be here, and I'm very excited to present on what NCC has been working on over the last year. Some of you may remember I was here last year talking about what we do at the National Coordinating Center for the Regional Genetics Networks, but I'm always happy to go into more detail. There are quite a few slides, so I'm going to go pretty quickly. But again, I'm happy to answer questions throughout this meeting or via email afterward. So I'm not going to spend too much time talking about what our system is. Dr. Singh just eloquently said that we are funded by the Health Resources and Services Administration, along with the regions and the National Genetics Education Family Support Center, towards improving access to genetic services for underserved populations. So my presentation today is going to focus on really what we consider the core areas of NCC, or again, the National Coordinating Center, specifically around genetics and genomics education and genetics policy education. I did include that we have a focus in telegenetics, as those who attended the telegenetics session earlier today, that is a core focus area of the entire system. And so NCC helps support the regions and their efforts to reach individuals via telemedicine. We develop resources, papers and things like that. So you can go to our website to learn more about what we're doing in telegenetics. And the other area that I won't focus on today, but that Dr. Singh just very eloquently summed up, is we are charged with data collection and evaluation. We're funded by the federal government. They do ask us to show the impact we're making, and as the National Coordinating Center, we're the ones who bring the regions together to determine the measures, the definitions, and to collect the data and then report it back. So the data that Dr. Singh just presented is SERN's data. Every region collects that same data and reports it back to NCC. As Dr. Singh said, we just finished year 6 of the funding cycle, so that was May 31st. So we're in the middle of our data reporting period, and over the summer, NCC will be publishing some internal reports that go to HRSA and the regions, and then we do publish web pages on our website that show the general reach of the system, not individual RGN data that Ronnie just showed, but more how the system is working towards our common mission of improving access to services. So I encourage you to go to the website. As we are just finishing year 6 data is not up there yet. It will be up later this year, but you can explore the last 5 years of data around the topic areas that Dr. Singh just spoke about. So with that, I will focus on some of our resources and tools and updates that we've made over the last year. So I hope most people in the room have heard of the ACMG act sheets and algorithms. For those of you who are not aware of the act sheets, these are a one-page clinical decision support tool meant for primary care providers or non-genetics providers. NCC is the one who is in charge of all of the act sheets that are within ACMG, and the reason for that is, and I should have said this earlier, NCC is funded to the American College of Medical Genetics and Genomics. So I sit within ACMG, and this is one of our partnerships between ACMG and NCC are the act sheets. And so we have act sheets for newborn screening conditions, non-invasive prenatal screening, secondary findings, carrier, and so forth. About a year and a half ago, we really started to think through how can we continue to maintain the act sheets. We were admittedly very good about creating new ones. We have about 100 act sheets, but we were trying to assess how do we make sure this information stays up to date. So we started a new process internally within NCC to make sure we're updating these on a regular basis. And through that process, I'm very excited to announce that over the last year, we've updated 26 newborn screening act sheets, published 4 new newborn screening act sheets, 25 algorithms, and 8 new algorithms. So those are all of the metabolic conditions, for those keeping count. So all of the metabolic condition newborn screening act sheets, if you utilize those, have been updated in the last year. We're in the midst of updating the hemoglobinopathies act sheets, so there's actually a few that have already been approved, and we hope that we'll finish the update this summer of the rest of the hemoglobinopathies. So if you're on the website and you're curious on if you're looking at an older act sheet or a newer one, I've shown a picture of what the current act sheet looks like. It's a little bit more of a modern look, and there's also a date in the footer, so you can see what is a new act sheet. So act sheets have been around for about 20 years now. They've been around a long time, and they're a very great resource. But we do know that they're a passive resource. It's a PDF that you go through and read. So one of the things we explored over the last couple of years is how do we make it more of an active educational offering? So one of the things we've done is create what we call the Knowledge Nuggets series. So these are short animated videos that accompany specific act sheets. They're 5 to 7 minutes. They are available for CME credit, so you can go through the ACMG Genetics Academy to access them and get credit. If you don't need CME credit, you can access them freely on our website. And I'm very excited to note that GAMPT, CRAB-A, and MPS2 were just launched Friday. So you were the first group to get that announcement that they are officially up. So we encourage you to go look at them. There will be 11 more that are published over the next few months. So please go in and we hope you watch the videos. So turning away from act sheets, one of the other things NCC does is help support healthcare interpreters and the training of healthcare interpreters. So you may be aware that we partner with SERN every year to offer a training within your region to healthcare interpreters. One of the other ways we support them beyond the training is expansion of resources. So in the fall last year, we published a new curriculum for interpreting for cancer genetics. So that is now part of 4 curriculum that we offer. In addition to those, we have glossaries in 9 different languages. So we just published the first 7 languages for cancer, and we're adding a 10th language, Russian, to all 4 curriculums. So this fall we'll have it in for pediatric, prenatal, autism spectrum disorder, and cancer, 10 languages. So you can access those glossaries, and they are separate from the training. So you can access these whenever you need to. In addition to those specific programs, we have a lot of different webinars that we run and educational offerings we do to different groups. And so I just wanted to put this up there so you could access other resources like our medical necessity webinar series, which is a 3-part series that walks providers through medical necessity and genetics. We've started an evidence-based guideline webinar series with ACMG to take the evidence-based guidelines that are coming out of ACMG and make them accessible for a non-genetics provider audience. And then the final thing is our genetics workshop for PAs. So this is something we started last year that I'm thrilled we could offer again. We partner with the American Academy of PAs and offer a workshop at their annual meeting. So their meeting just happened in May. Those get recorded and are freely available to PAs on their website for a year. So the 2022 version, which has 4 different courses, is on the AAPA website now. So we encourage anyone who can access it, please go and watch those courses and you can get CE credit. And the 2023 version or series will be up later this month. So I've talked a lot about educational resources, and that's really just the tip of the iceberg when it comes to NCC and the regions. There are a lot of excellent resources developed by our system, and so we have what we call our resource repository. It has over 700 resources in it, and you can filter by intended audience type, type of resource, subject matter, and then you get a brief overview of what the resource is, and then a direct link to that resource, so we can always ensure that we're sharing the most up-to-date resource. So we would encourage you to go visit that. So, moving past general genetics and genomics education, one of the tasks of NCC is to assess and distribute information about genetics policy. So as the National Coordinating Center, this is a major charge for us to work with the system in developing materials and resources that help individuals understand the policy landscape across the country. And this is where I will pause and say, especially based on the telegenetics conversation that was held this morning, which was excellent, our work is not advocacy. We are funded by the federal government. We are providing the educational tools and resources that you all need, and you can do with it what you may. So I sometimes get questions about, well, what about this piece of legislation? NCC does not comment or publish policy statements on specific pieces of legislation, but we do want to provide you the tools and resources you need to understand what's happening at the state and federal level and policy and coverage information. And that's what we've done with our Genetics Policy Hub. So this is a fully searchable website that's separate from the NCC website that has our 3 main tools as well as some general policy tools, which I will go over. So the first one is our policy area section. So this is what we really consider is a one-pager for a variety of genetics policy topics. There are over 30 policy area pages on the website, and the intention is to give those who may not understand why a topic is a policy concern a primer of like, okay, why is this a policy concern? For example, this is our genetics privacy one. It walks you through an introduction about why is privacy a concern when we talk about genetics, and then we highlight any federal legislation or regulation that is related to that topic. Finally, we then also share all policy statements from all of the national genetics organizations. So from the National Society of Genetic Counselors, American Society of Human Genetics, or the American College of Medical Genetics, as well as other specialty societies that have written policy statements related to genetics. So again, we're trying to just provide information. We're not saying one policy statement should be taken more weight over the other, but this is what's out there, and so you can learn more. We also have our Medicaid database, which is, we update annually. It gets updated every summer, so the 2022 version is up now. But what we do is look at publicly available information and every Medicaid program's website. So every state and every territory, we go through their materials that are up on their front-facing pages and seeing what they say they cover for genetic services. So there are over 30 categories of things we look for, and then we publish that every year. And so it can range from general coverage criteria to specific criteria for, say, children. It can have lab fee schedule information, or it could be specific coverage information for genetic tests like BRCA. So we have a lot of information in there, and again, I will note it is publicly available information. So for example, if a provider manual is behind a login, that information would not be included in this because we're looking at what's publicly available. So we encourage you to go look at your state's webpage. As I said, we are working through our 2023 update, and that will be live this fall. Our last big resource within the Genetics Policy Hub is that we track legislation and regulation. So this is something that is done every business day, that we look at what is currently proposed in every state and federal legislature or a regulation. So we utilize a system called Fiscal Note that has a bunch of search terms in it. Our project manager, Molly Case, goes through every single day and sees if the policy is related to the delivery of genetics. So for example, DNA comes up a lot in legislation. It could be about things that aren't related to the delivery of genetics. So we would not track those bills. But for those bills that do relate to services, we then track in our system, and it gets put onto our website. So you can go onto our website, click on your state, and see what's currently proposed, or you could go by policy area, and in each area you can read the full text of the bill, you can see who's sponsoring it, all the information that gets collected. However, we do know you may not go to our website every day, which you should, but probably you're not going to. So we've created a couple of different ways to get this information out there beyond our website. The first is we have a Twitter account, so you can follow us at Genetics Policy, and when a new piece of legislation or regulation is proposed, or there is major action, say it moves from one legislature to another, or it gets passed or vetoed, we publish a tweet about it. And in the tweet will be a succinct summary of what the bill or regulation is proposing, and then a link to the full text. So that's one way you can access the information beyond our website. We also compile all of those tweets weekly into what we call our Genetics Policy Weekly Roundup. So for those of you who are not on social media, you can get it delivered directly to your inbox every Friday afternoon of what we've tracked for that week. So lastly, I've talked a lot about a lot of different resources within the hub, and there is a lot of data in there, and we know that. So when we were conceiving this resource, we were trying to think of how do we make this information a little bit more accessible? How do we make sure that if you're interested in a specific area of genetics policy, that you can understand how to access the information. So this spring, we were excited to launch our Genetics Policy Hub webinar series. And as Dr. Singh said, SERN was our first collaborator on this, and it was an excellent presentation, very well attended. And we focus on specific topic areas. So the first one that Dr. Singh presented on with us was about medical foods. And so NCC staff will present on what information is in the hub related to that topic, and then the speaker will give real-world context for that policy topic and work they've done with it. So the first one was our medical foods one with SERN. The second one we held in May with our the New England Regional Genetics Network, and it was about genetics privacy. Then we'll have one in August 7th. We hope to see you all there, 2 p.m. Eastern. Will be about direct-to-consumer genetic testing, and we're excited to have Dr. Wynn Park, who is a PA, who helped develop the NHGRI frequently asked questions about DTC, speaking about her perspective of direct-to-consumer testing. So there's a lot of information within the Genetics Policy Hub of information we're tracking. In addition to just general policy that is occurring in the country, one of the other things we do under the umbrella of policy is we do workforce assessments. And so I know we've presented on this before. I know Dr. Anderson's presented data in the past on this, but I'm very excited to announce some updates on our workforce assessment. So for those of you who aren't aware, every 4 years, NCC does a workforce assessment survey. And so we assess what the current state of the workforce is and what the capacity of the workforce is. So we started that work in 2015, and then the second iteration of the survey was in 2019. And we are thrilled to announce that the lab geneticist manuscript was published 2 months ago, I think, 2 or 3 months ago. And this is the first manuscript that focuses solely on the laboratory geneticist perspective. So we were very excited to be able to publish this data, and this is from our 2019 survey. So while it is, we understand 2019 was 4 years ago, and the world was a little different then, it is exciting to have the first of what we hope to be multiple publications specific about this provider audience and what their demographics are and what their specific needs are. So we encourage you to go look at this. It's an open access article, so please feel free to read it, and I'm happy to answer any questions. And as I alluded to, we do this every 4 years, and 2019 was 4 years ago. So we've done the 2023 version. So I hope everybody in this room knows what I'm talking about because you got the survey. So this survey was our largest workforce survey to date. We surveyed geneticists, genetic counselors, metabolic dietitians, genetic nurses, and PAs in genetics. And this would not have been possible without many, many people in this room. We partnered with all of the national organizations that represent these provider categories to distribute the survey. So the survey would not have come from me, or not would have come from NCC, but it would have come from whatever home organization or membership organization you're a part of. And while I do not have the data yet to share with you, we do have the preliminary data, and we got the most responses we've ever gotten for a workforce survey. So it is excellent. We're very excited to start looking at this data. Again, we have preliminary data. We're going to start working on the first of what we hope to be multiple manuscripts of this and this summer, and publish the first one by this winter. Our hope has always been that we publish in the same year the survey was distributed, because we know how valuable this information is to you all, to hospital administrators, to policymakers, to everybody who is in the genetic service system. So please be on the lookout for those manuscripts as they get published. And I'm happy to answer any questions along the way about our 2019 survey or how we distributed the 2023 survey. And I have 2 minutes left, so I'll just quickly mention, and something that Dr. Singh said in her slides, is NCC also is in charge of the ACMG Phytogenetics Clinic directory, and so this is utilized by almost all of the regions as well. So when you go onto CERN's website and see the clinic listings, they are the same information that's in this directory. So this is my plea to please go look at your directory's listing. If it is out of date or something's wrong, you can always go to the submit a clinic in the top right-hand corner, and we will update it. And then as soon as we accept the update, it also will be shown on the CERN website, because they are the same database in the back end. So please, we encourage you to go do that. And with that, please feel free to reach out to myself. Follow us on social media. We are on Threads. We haven't posted anything, but we are there. So we're thinking about how we're going to integrate that social media platform. But we are on all the rest as well. So please feel free to reach out to us anyway. And just thank you for the invitation to speak today. Thank you so much.